Health Solutions, how MHA affiliates are expanding mental health supports. My name is Jackie Zimmerman. I'm the manager of Public Education Partnerships and e-learning, and I'll be helping to moderate today's session. I have just a few notes before we get started and hear from our speakers. This webinar is being recorded and will be emailed out to everyone within 1 week. We currently do not offer CEUs, but we can provide you with a certificate of attendance. I have a link that you can fill out a form to request your certificate, and that will be sent within a week. I'll post the link in the chat here shortly. And if you can't get it out of the chat, no worries, that will also come in your follow-up email. We might have some time at the end of our session today for some Q&A with our speakers. So please feel free to put your questions in the chat. We'll be collecting those and then as time allows, reviewing some of them as we can at the end. So if we don't get to your question right away, don't worry, we have it, we will, and we will also be providing resources afterwards. I want to note that this webinar and the work shared during today's presentation is made possible through funding from West Fraser. MHA National and affiliates have been working really hard to provide resources and programming specifically to rural communities through the support from West Fraser. MHA's National Resource Center can be found at MHA National/rural. I will also post the link to that in the chat here shortly, and that'll come in your follow-up. So you can explore a lot of the different resources that we've been able to provide, specific if you are living in a rural area or if you're serving those in rural areas. Which brings me to our panelists today. They all have been doing incredible work in their own communities to address rural mental health. And we have some awesome affiliates that are going to share what they've been doing, how they have been working in their communities, and some of their program goals, demographics of who they're serving, best practices, lessons they've learned, advice that they can share for those of you that might also be serving rural areas. So with us today, we have Erica Irving from Mental Health America of South Carolina, Shanna Mulvihill from Mental Health Minnesota, Ann Beckman from Mental Health Greater Dallas, and we may also have Stephanie Francis from Louisiana Mental Health Association joining us at the end. Welcome all. We are thrilled to have you and learn from you today. I'm going to go ahead and hand it to our first presenter who will kick us off here, and that is going to be Erica.
Thanks, Jackie. Hi, everybody. Thanks so much for being here. Again, my name is Erica Irvin, and I'm with Mental Health America of South Carolina. I actually joined Mental Health America in 2021 in Arizona. I was the executive director out in Arizona. And then about 3 years ago, my husband and I moved to very rural South Carolina, where we're at now. So this has been certainly an adjustment, no doubt, but it's actually been very wonderful. So one of the programs that I'll be discussing that we're providing under the grant is the I See Hope or Don't Duck mental health program. So we serve 4 counties under this particular grant. Those are Pickens and Greenville, also known as the upstate area, Newberry, and Allendale. The combined square miles for those particular counties, those 4 counties, are approximately 2,300 miles, and the average individual income for those particular counties is anywhere from $18,000 to $39,000 a year. The capital, South Carolina, is designated with the red star in the middle of the state. That's Columbia. And I'm currently in Pickens County, which again is the top blue star on the map. So you can see how far I am from other rural counties served under the grant. And to put this into perspective, just how rural of an area I'm in, the nearest grocery store to me is approximately 30 minutes away. So like I said, it's definitely been an adjustment moving from the greater Phoenix metropolitan area to very rural South Carolina. So again, we are providing the I See Hope Don't Duck mental health program. In the first year of the grant, we were providing a couple of programs, but the most successful program was the I See Hope Don't Duck mental health program. So this program is designed to erase the stigma surrounding mental illness and raise awareness of mental health issues in our society by reaching children in a classroom setting. As you can see in the top picture, Our mascot is Icy Hope. Icy Hope has a Band-Aid on its forehead to teach children that brains can get hurt or get sick, but they can also heal. The life preserver around its neck teaches children that every life is also worth saving. With this program, we're providing resources and materials to teach children about mental health in age-appropriate terms. In the smaller picture on the screen, you can see what we call the bucket. And that bucket includes a duck puppet, along with other items, including pencils, coloring sheets, stickers, bookmarks, paper bag puppet materials, and books. And when kids are provided these resources, we know they'll ultimately take these coloring sheets, bookmarks, and paper bag puppets home to their parents or guardians, which may filter through the home and provide resources and information about Mental Health America, what the program is, and instructions for an adult on how to take a free mental health screening on our website. Additionally, within that bucket, we provide 5 different books for the educators and counselors that are designed for the K through 5 age range, and they cover 5 different topics. Those topics are how to handle a bad day, understanding stress and time management, understanding anger, understanding the effects of a bully, and dealing with bereavement and grief. Now, we've heard from educators that these books are truly instrumental in reaching the children and helping them understand their feelings during a difficult time. Specifically in my rural area of South Carolina, I've heard from educators that children have lost parents or family members to substance use and also vehicle accidents because of the dangerous and winding single-lane roads here in South Carolina. So by utilizing a friendly duck mascot, we can teach kids don't duck mental health. We have had some unique challenges, that's for sure, in this program. Offering free resources doesn't always mean that organizations and or individuals will take advantage of them. In the first year of the grant, we were providing another program for free mental health training, and we thought everyone would jump at the chance for free training, but unfortunately that wasn't the case. Even in the first year of the grant, some schools and school districts were hesitant to take advantage of the Icy Hope program and the materials because of the patch schedules of the teachers. Initially, our goal was to go into the schools and provide the information, the resources, and the activity during the school day. But what we learned was that teachers are required by state law to provide specific curriculum, and they were overwhelmed by the thought of adding more into their day. Additionally, collecting data has been especially challenging in the rural South because of the stigma surrounding mental health. It's still very much a taboo subject in the rural South to openly discuss one's mental health. And much of the same goes for the mental health screenings. There's too much stigma surrounding mental health, and some are concerned about the information being truly anonymous. So we had to ultimately think outside the box. First, we had to understand our audience. As I mentioned earlier, educators and school counselors were hesitant to take advantage of this program. So we really had to shift our focus from going into the schools to present to the teachers and students during their academic day to trusting teachers to use these tools as situations arose. We learned that educators are usually required to attend ongoing trainings and or meetings after the school day has ended. So this is where we've been able to successfully get information and the resources directly to the educators. Once we informed the schools and the school districts that we were giving them the tools without adding additional curriculum into their day, they ultimately jumped at the opportunity to have the resources in their schools. And one of our other staff members has provided the Icy Hope program to the local after-school karate program in Newberry, and that was a huge hit. So to be successful, we also needed everyone to understand the data. Additionally, in this grant cycle, we added education into promoting the 988 Lifeline throughout the community and through some of our other presentations. When we go into any organization and provide mental health information, we ask the attendees to take a short questionnaire about what they learned. We explain that the grant allows us to provide this information and the resources, and that we use the information to improve our training programs and that the data is used to help us understand where we can provide more services. One of the things that we've learned from the start of this new grant cycle, which began on July 1st, is that prior to the training, um, I should say prior to the training that people have received from our organization at MHA of South Carolina, approximately 40% of the attendees were actually not familiar with the 988 Lifeline. And, again, coming from a large metropolitan area, I was shocked to learn how many people just were not familiar with 988. So this data is invaluable to us and the surrounding communities. And then we also need to ensure data confidentiality. Along with our local questionnaire, when people are taking the national mental health screening, we ensure complete confidentiality. We let people know that we don't ask for their name or personal information. We understand that even asking demographic information is frowned upon, specifically in rural areas. So we explain that demographic information is being requested because it allows us and our funders to understand the needs of the communities. And it could therefore potentially lead to additional funding in their own, sometimes very small communities. So being completely transparent about why we're asking these questions has actually increased the number of people actually taking our local questionnaire. So I know that was a lot of information very quickly, but I hope some of this helps you and your organization to think about what you're doing, how you can improve your current practices, and how you can also think outside the box to ensure you're reaching the right people and organizations. So as you can see, I've included my contact information here for anyone that has any further questions or would like to discuss anything further, maybe even about the program or some of the other challenges that we've faced during this particular grant cycle, specifically in the rural areas. So again, thank you all very much for being here today, and thanks for allowing me to speak.
Thank you, Erica. Just a reminder to everyone, continue to put those questions in the chat. We'll have them open for all of our speakers at the end. And I'm going to hand it over to our next presenter, which will be Shanna.
Great. Thank you, Erica, and thank you, Jackie. I'm Shanna Mulvihill, Executive Director and CEO of Mental Health Minnesota since 2015. And sorry, I think I caught a bit of a cold. It's getting a little chilly up here in Minnesota, so I may cough a little bit throughout my time, so my apologies in advance for that. Um, our organization has provided mental health support and resources and education and advocacy across the state of Minnesota for more than 85 years. I also serve as one of 4 regional policy council representatives for Mental Health America, and I cover states across the Midwest, so rural mental health is certainly a very common topic for our group as we meet monthly. I also personally am a resident of a rural county in Minnesota and a hobby farm owner, an outdoor enthusiast, an avid volunteer and a football fan, a mom of 2 growing boys, and a vice chair of my local school board. Just kind of nice to know who you're hearing from sometimes, I think. So I'm going to talk a bit about the grant that we got and how we are using it to provide free and anonymous resources and support specifically for the Beltrami County area in Minnesota. So first I want to talk a little bit about the geographic areas served under the grant. So that the area served by this grant and covered by the grant is the Beltrami County area in northern Minnesota, and that's shown here on the map in red. Um, at just under 2,500 square miles, Beltrami County is the 4th largest county in Minnesota. It's also about the size of Delaware. Um, and the Red Lake Nation, which is home of the Red Lake Band of Chippewa Indians, is a sovereign nation whose reservation is also located mostly within the borders of Beltrami County as well. The total population of the county is right around 47,000 people. And about a third of that population lives in its largest city, which is right down at the bottom, at the southern tip of Beltrami County. It's called Bemidji. The rest of the population largely lives in small towns and rural areas across the county. Bemidji is also home to two higher education institutions, so Bemidji State University and Northwest Technical College. So that also brings an additional student population of right around 7,500. Beltrami County is not heavily agricultural because as we get further and further north in Minnesota, it becomes more and more heavily wooded, which is why I included a photo on the far right, the upper right, of what a lot of the county looks like. But Beltrami County is absolutely known for its really, really beautiful natural areas. And the southwest part of the county is actually considered the start of the Mississippi River. I'd like to talk a little bit about the population that we're serving. So as we looked at who we would be serving, so we could start to think about what we could really do and what we could think about in terms of serving some of the rural areas, really across the state, but specifically in Beltrami County. We started paying attention to specifically our screening data. So we have online mental health screenings available on our website, as most Mental Health America affiliates do. And so we are able to glean a lot of great data from those screens, and then also align that with a lot of other data as well. So we got some of this data from National as part of the grant process. Some of it also came from other sources as well, from within Beltrami County, as well as our own screening data. So some of the observations that we were able to make is screeners in Beltrami County were significantly more likely to identify as American Indian or Alaska Native at 25% than the general population of screeners in Minnesota. And that was also significantly higher than the percentage of American Indian or Alaska Native individuals in Beltrami County based on US Census data. So we are noticing that more of those individuals are taking our screenings. I always tend to see taking screenings as a very positive thing. If people are paying attention, what we want to do is get them to take the next step of seeking help or support or whatever it is that they might need. A pretty high percentage of Beltrami screeners were young adults between ages 18 and 24. And I think, frankly, that's largely due to looking at those higher education institutions and the populations at those, because I think those are going to be common ages right at those institutions. Screeners in Beltrami County do tend to report lower household incomes than the average among the Minnesota screening population. So 29% have a lower household income than, or household income lower than $20,000. That's compared to 18% in Minnesota statewide, and 53% had a household income less than 40,000 compared to 35% in Minnesota. So it does tend to be a lower income area. They also were more likely to identify as trauma survivors than the general screening population in Minnesota as well. A couple of other observations that were not as connected to our screening data, but I think are important to note about the population that we're serving. And that is substance use is a significant concern in this area as well. The binge drinking rate is higher in the county than the Minnesota average. And there was also a pretty significant increase in fatal overdose deaths in 2024 over previous years. Food security is also a large concern. And I mean, I think we can see that's a growing concern in a lot of places, but it is a large concern in Beltrami County. Just in 2024, an estimated almost 13% of the population experienced food insecurity. And that was the third highest rate of food insecurity, and they had the fourth highest rate of limited access to healthy food of all counties in the state. So some of the things that we're doing with the grant to provide support and resources is one, just working to ensure that we can continue to provide the resources that we already have in place to the area and track utilization of those services. So the two primary pieces related to that is one, promoting the use of online mental health screenings. Erica talked a bit about the importance of using those screenings. And I think those are so critical because it's an initial checkup on your mental health and can really be a kind of I see it as a gateway to connect potentially to services or support. It can also really be an awareness builder of what else might be out there. And so we're doing some promoting of use of those screenings. We also are just, some of it is just making sure we can keep the doors open of our Minnesota Warm Line service. So our Warm Line offers peer support through phone, text, and chat 12 hours a day, 7 days a week. And that is available statewide. So some of this funding goes to simply support making sure that that service continues to be available. A second goal was really wrapped around increasing awareness of the resources and services that we provide in the Beltrami County area. And so that's been about, working to build partnerships and collaborations with new partners and providers. Erica had a star showing, where she's located and where some of the counties she's serving are. And I'll note that as a challenge as well on a later slide, but we're about 300 miles away from my offices away from Beltrami County. So it is a challenge. And so this is a great opportunity to be able to build some of those new partnerships and collaborations, as well as work to connect with the Red Lake Nation and residents of some of the more rural areas of Beltrami County as well. Also an opportunity to connect more directly with the colleges or the college and university in Beltrami County. So again, Bemidji State University and Northwest. And then attending community events and sharing some of the resource cards. So we provide these small little wallet cards that tend to be very popular because they're little, they, are something you can just put in your wallet or hand out to someone. And the most popular ones that we have one that says in a crisis, and it has 988 information on that side, and then it says need support, and it has our Warm Line information on that side. We have another one that's about screening and our resources, and so it's, take a screening or get some information and resources. So very simple, but very popular. And so we've been sending those out a lot. And we send those out, to a lot of different places, to mental health providers, to law enforcement, to churches, to hospitals, to schools, to colleges and universities, a lot of different partners who are interested in sharing our resources. We've also really been working to help promote 988 as well. We are a 988 center statewide. In Minnesota, we answer text and chat. And lastly, we are working to provide mental health and suicide prevention, education, and training in Beltrami County. For us, that's been about developing and providing online trainings given the distance and the weather-related challenges that can exist here in our state. So developing and providing some of those online trainings to promote stress management and resilience and suicide prevention, as well as providing in-person safe talk trainings, which not only provide trainings and education in the community, but really help us build those personal connections. Want to note just a few challenges to our work. Minnesota covers a very large geographic area. So our state is, sorry, excuse me, almost 87,000 square miles. and includes 87 counties. 80 of those counties are in greater Minnesota, which is outside of the Twin Cities metro area, who are not, for those who are not familiar with it. 7 of those counties are frontier counties. And if you're not familiar with frontier counties, that means there are fewer than 7 people per square mile within that county. Over time, Beltrami County has also had one of the highest suicide rates in Minnesota. In 2024, the suicide rate per 100,000 people in Minnesota and the United States was 14, and in Beltrami County, it was 22. But when we talk about suicide prevention and mental health in rural communities, and many of you who serve rural communities know this very well, we don't necessarily talk about it quite as openly as we might in other places. So instead, perhaps we talk about stress and resilience at a minimum to break the ice. So we can create opportunity to have those conversations in a more open manner. To connect with people living in rural areas, showing up in person can be really important. But our office is more than 300 miles from Beltrami County. And so it does take time to build those relationships, especially if they're new, and connect people to services and programs and to education. So having 2 years of funding instead of just one has really been critical for that. So we've had some additional time to really get things, be able to really start to get things off the ground in this second year. It's worth noting cold weather and heavy snow is a challenge in Minnesota. Temperatures in the single digits to teens for months can be a barrier to participation and travel in North Minnesota. So having time to offer education and training or attend events can be a little bit challenging. I mentioned during our check-in time right before this that we have our first wind chill here in Minnesota. And I have to go to a football playoff game tonight, so I'm not really excited about that, but I'm here for it. And finally, access to reliable internet and cell service, as is the case in many rural areas, of course, can be challenging. But these are actually really critical to accessing our services because they're all delivered through phone or text or chat. Or just on the internet in terms of the interactive tools we have on our website, like it's doing a safety plan or a wellness plan, taking an online screening, as well as reaching the lifeline. And that's particularly true in tribal communities. I was reading just recently a Beltrami County 2025 to 2030 community health assessment that reported that 30% of people on tribal lands in rural areas lack broadband access compared to 14% in non-tribal areas. So there are some real disparities there. Wanted to end with this slide to note that I think so often we talk about all the challenges of providing mental health services and the challenges that exist in rural areas, but rural areas are beautiful and wonderful places to live. I live in one. A lot of us probably on this call either serve rural areas and or live in rural areas, and we do those things for a reason, right? So I just thought it was worth calling out that Beltrami County area is also a beautiful and wonderful and diverse place. And so it's important to highlight the good things as well. And I think things like the community health needs report that I just mentioned did a really lovely job of doing that, right? Called out some really great things the communities have going for them as well. So I think while we want to acknowledge the challenges of serving areas, I think it's also important to note that these communities are resilient and they pull together to support each other. And so I just wanted to highlight that as I wrap up. So with that, yes, Babe the Blue Ox, I just caught that. So thank you so much. And with that, I will wrap up and turn it over to the next speaker.
Thanks, Shanna. And I love that reminder. It is so important. Our rural communities have such resilience and strength in unique ways that are so helpful to strengthening mental health. I will hand it over. Our next presenter is Anne. So Anne, take it away.
Okay, good morning. I am, oh, went too far. Hold on, let me go back. There we go. I am Ann Beckman. I am with Mental Health America of Greater Dallas, one of the many affiliates there are. We are very blessed to have received the West Fraser grant over the last 2 years, or a year and a little bit, I should say. We received the grant for our program of WHO. The WHO program is a program for kids in schools. And you see a picture of the owl at the bottom, Heidi Owl. This is a hand puppet, is the mascot for the WHO program. I've been with Mental Health America as their education coordinator for going on very close to 2 years. I'm a 30-year educator. I've taught for 15 years, and I was an assistant principal and principal for 15 years, all kind of throughout the Dallas area. My husband and I have moved out to just borderline of East Texas. So this grant providing East Texas was a really good fit for me. I am also just trying to keep my foot in the door with education and have joined the school board, been on for 3 years. It's a great community and a great position to keep up with education. So our grant for year 1 and 2 have been for the East Texas regions. And as you can see from the picture, it is a very large area. Of course, Texas is a very large state, but the area is divided into an upper and a southwest region, and even subdivided into the prairies, the piney woods, and then, of course, the wetlands Gulf Coast. Our focus, as it is highlighted in yellow, is really the piney woods area. On year 1, we worked with Jefferson, which is in the upper area, and with Henderson ISD, which is in the Piney Woods area. In year 2, very luckily, we have been able to expand that to many districts throughout this area and trying to get into their school districts to present our program. You can see the whole area covers 28,000 square miles and 38 different counties. So it is a very large area. Tyler is kind of the focus of the area, right in the middle of the Piney Woods. And each year for the last 2 years, we are doing and have done a what's called On the Road Symposium, Adolescent Symposium in Tyler, just trying to reach out to more educators, more mental health providers, hospitals, police departments, different areas that want to help us back the mental health of our youth. So the WHO program is all about helping kids not become a victim. And as a principal, I noticed that as we hit COVID, not only the students, not only the parents, but also the staff really struggled with, oh my gosh, we're in this shutdown. How do we get through this? The feelings overtook, the problem solving was non-existent. So when I was called about 2 years ago by our executive director to run this WHO program, the We Help Ourselves anti-victimization program, I did a lot of research on the program and found a lot of value that could really help our kids in schools. It is a program for kindergarten, or actually pre-K all the way through 12th, with the focus really of about K through 5, although there are lessons and resources for all ages. So it is designed to help protect our adolescents from victimization. It helps them deal with difficult feelings. It helps them cope with unwanted situations, and understanding that those situations are going to come your way. The program is really based on having a trusted adult that we know may or may not be somebody in the household. It could be a teacher, it could be a counselor, it could be a coach, somebody but having them know that there are trusted people that they can go to and talk with about unwanted situations or difficult feelings. It's also helping them, especially the younger kids, identify strangers, that sometimes a stranger is somebody that your mom spends a lot of time with, but nobody that you really know. And sometimes it's because you don't know them very well, doesn't make them a stranger. So it really talks a lot about helping the younger kids understand and identify strangers. It also helps at all ages just navigate decision making, helping them understand that unwanted situations could and will come their way, and that there is a way to problem solve and have some ideas about what you might do. We know that a kindergarten could be very upset by somebody being mean on the playground, and that is a real problem for them, and they need to be able to problem solve and navigate through those problems. The older kids, of course, could have much more difficult things that come their way, whether it be abuse or trauma or thoughts of suicide, and there are lessons on all of those. I will talk about the things that make it very hard to get this into schools on the next slide, but I've really had to refocus and talk to counselors about using this as a resource, and having even the older kids, the counselors of the older kids, really look at some of these lessons and some of these questions for ways to start talking with some of their kids that are hard to reach. The whole program is based upon helping kids stay safe and happy. And these are words you just don't hear very much in, the state of our world these days, but our kids deserve to be safe and happy and problem solve through difficult situations and know who trusted and welcome adults are. So some of the issues that I have found throughout this program, some of our unique challenges, as I stated before, the first year we were focused on 2 districts, the Jefferson and the Henderson. Jefferson was a very small community. They have exactly 1 person for the whole district who is a counselor. They do not have counselors on each campus. So she herself, we've met, we've talked. She is looking through the WHO program, but this is year 2, and her time is just very hard for her to even look through the program. Henderson is another area that we had in year 1, and Henderson ISD has had many changes in the last year. They got a new superintendent. They moved people around. The 2 counselors that I spent time with and had a relationship with have moved to other campuses or to other districts. So it has, made that very difficult. So we were very glad to have these resources through the West Fraser grant for year 2, where we could broaden our reach into many, many other school districts. I have been surprised, as I've heard others say, they were offering a free resource, a free program with everything included, lessons, videos, curriculum, everything that goes together, and school counselors have been very hesitant to even look at the resources, knowing that there is no obligation if all they do is look through and see what they might be able to use. I've been a principal over counselors for many, many years and have never been a school counselor, but I know how protective they are of their kids and of the families that they serve. So, getting through and building that relationship has really been difficult and hard to do. Many of the districts that we are reaching out to don't have mental health counselors. Most of them actually don't in East Texas. And so they're dealing with very small counseling staff. A counselor could be elementary, intermediate, and middle school, or middle school and high school. And for those of you that haven't worked on a campus in schools, high school and middle school counselors don't get into classrooms. They're scheduling, they're testing, they're trying to get kids across the graduation line. They're doing all the state regulation that is out there. So they have very little time to learn more about programs and dig through things. We have been able to upgrade our portal for the WHO program, which has made it much easier for counselors or nurses or police departments, SROs, school resource officers to look through the things that we do have in the WHO program. So that's been very much a plus and has very much helped. And the last unique challenge is just the counseling staff changes, as I talked about earlier. I have had pretty good luck in reaching out to other districts and having one or two people respond. East Texas is known for being a drought of mental health resources. I think the parents want more for their kids than they have. Many of the parents are just high school educated, maybe 1 year of college. The average income in East Texas over the two areas is less than $50,000 a year. But these parents really do want more for their kids than they had being raised. So this WHO program is a really good fit for their kids. Once we are able to establish relationships with school districts, we can do things like send home screeners for the parents. The parents can do them on the kids. Old enough kids can do them on themselves. We already know that. We did last year do billboards with screening information in the larger areas, that the two areas that we were working with, and we did not have much of a result at all. So our hope this year is to be able to do those screeners through schools as we build those relationships. So thank you guys for letting me present today, and I will hand it off to the next group.
I'm on mute. Thank you so much, Anne. That was fantastic. It was lovely to hear from you and all the incredible work happening in Texas. We have our last speaker with us. Stephanie is joining us. And Stephanie, I will let you take it from here. Just a reminder, everyone, if you're putting questions in the chat, thank you. If we don't have time to get to them all, we will make sure to send information in the follow-up. But Stephanie, take it away.
Thank you. I'm Stephanie Francis. I'm from the Louisiana Mental Health Association. I will go through my slides quickly. I will no doubt have a little bit of repetition in here from what you've already heard. And I know that everybody's anxious to ask some questions. So we too were very lucky to be able to participate in the West Fraser grant for both years of the grant. We are in our service area, particular service area where West Fraser is located is in Joyce, Louisiana, which is in Wynn Parish. And you see, this is an area of Louisiana that is known as Sinla. So the largest city in there would be Alexandria, Louisiana, which you may or may not have heard of. But it's a very small area, extremely rural. Most of the region, West Fraser is a regional employer that employs a good number of people in the Wynn Parish area and beyond. We have had, we went into this starting with some conversations of several of our existing partners in the area, including the Central Human Services Authority. In Louisiana, we have 10 local governing entities who put the mental block grant dollars down on the ground, and they're the one that's servicing this area. So we know them very well. They help sponsor a behavioral health council within Wynn Parish. And then the Repeats Foundation was developed after the sale of an hospital in the area. And they do an annual, I think it's biannual actually, comprehensive needs assessment. And so they had done a needs assessment on Wynn Parish. And everything that was coming back to us was, we want all kinds of trainings. We want to know we want training in suicide prevention. We want training in mental health awareness with youth. We want training for some of the programs that Louisiana Mental Health Association does, like Target Health, which is a whole health management program, so they can implement that. So we said in year one, we're going to offer this plethora of trainings. And we are going to also have some events for behavioral health professionals in the region. They wanted education, education, education. So that was our plan. And then we really saw ourselves as the cavalry coming in, riding in to implement all these great programs, and to bring resources to this area that really has very, very few resources. And we thought we had built the field of dreams, and we thought that they were just going to absolutely come and show up and attend all of these wonderful trainings, and that the resources were free, and that, as they had said, they needed them. And we thought that this would just be an easy fit for both of us. It was not, in fact, that way. We did build it. No one came. The field was empty. So halfway through year one, we said, okay, we've got to pivot. This is absolutely not working. So we went back to our friends. We went back to the behavioral health counselor. We said, what are we doing wrong? What can we do better? We went, this time we expanded our conversations, went to behavioral health facilities in the area. Mostly those are dealing with substance use, but some beyond that. And then we started looking at the Facebook groups and the social media and what people were posting about, and what people were Googling. And so we came up with a different plan, and we said, all right, you have all of these events that are already existing in the community. We're going to start attending those events, and handing out information about who we are, and the resources we provide, and also just general mental health information. So our engagement, I said, if 2 or 3 were gathered, we were there. And that is really true. We were going all of the time. We were sending materials. We were doing everything. They have a community baby shower. We took all of our maternal mental health information to the community baby shower, back to school night. We went to hospital resource fairs. But we really went to a low impact but high touch strategy for the second part of year 2. And I have some pictures that show that. The one in the top left, I particularly love, because we were one vendor, the only vendor there, who came, and one of our staff members brought a child with her, and but we were there and we showed up. And on the other one, where you see a woman holding a book, she was the only one that showed up for a training. So we did the training, but we were there, and we were present. So that was our strategy. And how it's going, it's working out great. Our year 2 strategy has really, really paid off. We are now being invited to do things. Recently, the Wynn Parish School Board reached out to me and said, hey, we want you to come and train our teachers on a professional development day. You will have every teacher in Wynn Parish in the room. And so this was the very opposite of what we had from our initial reports. I mean, our initial approach. We've had thousands of billboards. I've supported us all over the county. And so going back to really having a present and doing non technology marketing has really made an impact. And we feel like we are really seen as part of this community now. In fact, we were also invited to put mental health information in all of the Thanksgiving food bank boxes that are going out this year. So that's really exciting. And I'm going to wrap with this slide about lessons learned. Time is your friend in front of me. When we first went, we thought, oh, we have this short time. We're getting out there, but it takes time. And it's not only what we found, it's not only what we can provide, but also taking in the feedback. Lesson 2, Boudin. I don't know how many of y'all have Cajun relatives, but Boudin is a very Cajun food. And I put this on here because we now know that once you leave Baton Rouge, which is the capital of Louisiana where we're based, and head up to Wynn Parish, you will not be able to get a decent cup of coffee, but you can get all the Boudin you want. And I say that to say, we now go up so often. We know the route. So we just started going and continually going and continuing to show up and continuing to make that drive. And thankfully, Shanna, we do not have to deal with the snow, weather, wind chill that you do. So it's a lot easier to do that in Louisiana. And the other lesson that we learned is that you have to be persistent. You have to keep, not only do you have to keep showing up, but you have to keep calling. You have to keep emailing, and you can't wait for people to be in touch with you, because what we really learned in a rural community is that so many folks are wearing 10,000 hats. And they're doing 9,000 things. And while they want this information, they know their community needs it. It's just they're overwhelmed on the daily. And so if you can keep showing up, bring the resources, make them palatable in an easy, absorbable way, and become part of the community. And so that's what we did. And the last lesson learned, it's just all hands in. It's taken all of us. We're a very small staff, but it's taken a lot of multi-dimensional approaches to really make an impact with this grant, and to be successful in that area. So I'm going to, sorry, I only left 5 minutes for questions. My goal was more, Jackie, but here we are.
That was wonderful, Stephanie. Thank you so much. It really proves the perseverance, and I love the pivot. When you recognize we need to make a change, and how you really stuck with it and ended up being able to serve your community in such incredible ways. It's a testimony to itself. So thank you. And thank you to all of our panelists for sharing about your programs. I invite you to all come back I know we just have a couple minutes. We had a few specific questions that I've been gathering, other questions I've been trying to answer in the chat. One question that was specifically for Erica, a question came in asking, how did you work with the school district mental health coordinators to identify what schools needed this type of mental wellness support, and determine if the IC Hope program complemented their existing program or programs? How did you handle those referrals that might have arose when discussing mental health with kids?
Okay, that's a lot. I'm going to try and work with all of that. So to be quite honest, again, in my particular area, specifically in Pickens County is unfortunately one of the poorest counties in the state of South Carolina. So the resources here are pretty much slim to none. And so just getting out to the schools and presenting the information about IC Hope was like a light bulb moment for them. They realized this is really good information. We really need this. But again, they struggled with, but how are we going to get it into the schools? I had to first and foremost, because I was newer to the area, I had been in Arizona for many, many years. I had lots of contacts everywhere. I didn't have that when I moved here. So I had to really focus on trying to reach out and utilize any resources available to me. That literally included my own neighbors in my community. And thankfully I live around people who work very closely with the schools, knowing how poor, if you will, the outside community is. So they, first of all, got my foot in the door to these schools because I just didn't have all these wonderful contacts where I could go in and just walk right in the door and say, hi, here you go. Here's what I have. So I had to work with what I had. So with that, when I did approach the schools, they were very open to it. But as I also mentioned before, it wasn't easy just because of the state mandated requirements for curriculum for the educators and the counselors. And like some of the other panelists have spoken about, going into the schools was also very hard simply because some of the schools lack school counselors as well. So they're stretched very thin, and some of the school counselors, they float from one school to the other. So I really had to focus again on trusting the schools and being able to just have the information and the tools that they needed. And even though part of the question was, how did you determine what the needs are? I'll be quite honest with you. All the schools need this. And because it might not be a large population of the kids that need it, it could be just one child that needed the tools and the resources to help them, help their families. Because as I mentioned, when doing the activities, kids would take the coloring sheet and they'll scrunch it up and they'll put it in their backpack and they'll take it home with them. And that was our goal. Our goal was to make sure that that information got from that classroom where that child was to the home. So it could be almost a ripple effect with the family. So I hope that helps to better answer some of it. Again, I know that there was a lot in there. I
Yeah.
might be leaving some stuff out. So if anybody has additional questions, please feel free to reach out to me.
Yeah, amazing answer in our short bit of time. And I know we're right at the top of the hour. We could keep going probably for another hour here together and chat more about these programs. I know everyone has had fantastic feedback in the chat, but we are going to wrap up today. I want to remind everyone, if you had a question in the chat, don't worry, I'll be going through them. We'll be sending out follow-up information to address any of your questions, contact information for affiliates in your area, and for our speakers if you have specific questions for them. But thank you all so much for being here. A huge thank you to our speakers for the programming that you're doing, the dedication you have to your communities. It is truly so wonderful, and it's making all the difference in these rural areas. And thank you to everyone who joined us, those of you who are posting your own resources, asking those questions, staying involved and connected to MHA. We are so appreciative for you taking the time to be here today. I want to remind everyone that this is being recorded and it'll be emailed out within the week. So you'll get the recording, you'll get all the resources we talked about, you'll get links to explore our affiliates and the work they do, along with our work that we've been doing at National with West Fraser, who, again, we want to give a special thank you to for funding our work at National and funding these incredible programs that are happening in your communities. But with that, Shanna, Anne, Erica, Stephanie, thank you for being here, for all of the work you do in and out every day. We're really grateful that you could share about your programs with our audience, and thank you to our audience. We hope everyone has a fantastic rest of your day. And as we send out the follow-up, please share this information, share the recording, and all of the resources that come with it. Thank you all.